Hi, I'm Dr. Dave with Bonfire Engineering and Construction. Today I want to talk about telemedicine. It's something Bonfire has been involved with in terms of helping service providers engineer and build broadband networks. But this week I got to experience it firsthand through a virtual doctor's appointment. This was an annual exam that I'd had on my calendar for months, but with the stay-at-home orders in place, I was expecting them to call and cancel since it was just a routine checkup. Well, they called and said that I had a choice of rescheduling, or I could keep the appointment but do a virtual exam. A virtual exam. I'd never done a virtual exam before, nor any other kind of telemedicine for that example. So I said, cool, let's do virtual. To get ready for it all, I had to download Google Duo and just create an account on it that links it to my cell phone number, which was pretty easy. And the appointment was set for this past Monday at 8:30 a.m. And within a minute of that time, phone started ringing. It was Google Duo with my doc. And my first thought was, wow, a doctor's appointment that started right on time. Nice. I'll skip the details of the exam and spare you from the too much information. But in under a half hour, the exam was over. I was back at my desk working in no time. Pretty cool. Now, the notion of telemedicine or telehealth has been around for decades, but its adoption has been slow, primarily due to insufficient bandwidth, technology limitations, resistance to change, and especially concerns about security and privacy of healthcare data. Nevertheless, it has gotten traction in rural areas where access to healthcare is a bigger challenge. Obviously, in extreme remote areas, just seeing any doctor could be difficult. But even in rural towns that are big enough to have a health clinic, they usually won't have medical specialists. And these are all factors that are driving telehealth. And in many respects, rural America has been the cutting edge of telemedicine. But that's now changing due to the coronavirus. Now it's not just rural America doing it, the entire country is. No matter where you live, if you're looking for non-emergency healthcare anytime soon, you're likely going to be doing it virtually. So where is telemedicine today? Most of it consists of just a video link between a doctor with a laptop and a patient with an iPhone. Obviously, the doctor can't use a stethoscope or test reflexes with a little hammer, but it's impressive what they can do with just a video link. For example, family doctors, dermatologists, and internists are using telehealth to assess conditions from a urinary tract infection to early signs of skin cancer to broken bones. And of course, they're trying to triage patients who might have coronavirus versus the flu or even just springtime allergies. So each discipline has its prescribed steps to determine the likelihood a patient has a certain condition. Take, for example, appendicitis. I've read one doc who says that he assesses the likelihood a child may have it by having him do jumping jacks and see if he's smiling during that. Now, I don't know if this was tongue-in-cheek, but I offer it just to kind of highlight that there are a lot of clever and creative folks out there that are finding ways to examine a patient without actually being there. Of course, there are times when a video link just isn't enough. And in those cases, there are simple devices that can be sent to the patient's home. For example, a chronic patient, or a patient rather with chronic disease, will have internet-enabled equipment sent out for monitoring such things as blood pressure, blood sugar, or heart rhythm, just to name a few. Now, looking forward, there are a number of drivers that are going to affect the growth of telemedicine. Obviously, the coronavirus is and will be for some time. It's already caused telehealth appointments to surge, and experts are saying that it will be critical in managing this epidemic or pandemic even. But by the time the virus is no longer a concern, though, there's a good chance that the majority of us will have had a virtual exam like I did. And I have to believe most will find it a positive experience, also, just like I did. Also, baby boomers are aging and will need increased care as they do. So telehealth will allow providers to reach them all and also increase a doctor's efficiency. they can see more patients in a day, and retired or part-time docs are going to be more willing to take patients via telemedicine when they can do it from home. So all this will help baby boomers while still maintain quality care. Finally, I'd like to address briefly what the roadblocks are. There's been reluctance by insurance companies to pay for telehealth. I think they've been worried this will be overused, but I have to believe this is going to be resolved soon because it's certainly cheaper than a patient coming into a clinic. We also need to make sure that patient privacy is protected, and that'll take time and money, in my opinion. On the one hand, we can't allow companies to shortchange healthcare data security because we don't want to see with security breaches with healthcare data like we've been seeing with the personal and credit card data of hundreds of millions of folks in the US alone. On the other hand, we don't want to have regulations so strict that they effectively make telehealth not even viable. So obviously we have to find some kind of happy medium. There's also technology that I think we can look forward to. We can expect much of the health monitoring equipment just built into our phones and watches. And all of these devices are going to be integrated into the 5G networks, which will provide mobility. And of course, artificial intelligence is going to transform telemedicine, like it will for all things, but in ways that we can't yet even imagine. So I'm excited about that. In summary, coronavirus has turned a spotlight on telemedicine, which I think is a good thing. It'll increase the pace of innovation and make the experience better and better. I believe years from now, we'll look back on this and see adoption of telemedicine as one of the good things to come out of this very difficult time. Based on my experience this week with the virtual exam and its simplicity and convenience, I'm going to look forward to a future where telemedicine is a common occurrence. And I think you guys will too. But to get from here to there, every community in the country needs to get started. And there are a number of different components that come together to enable telemedicine. And one critical item is internet access. And unfortunately, it is a long lead time. The good news is the bandwidth doesn't have to be that great. For what we're doing today, 5 megabits is plenty. And the vast majority of subscribers get that in the downstream. The bad news is you also need that in the upstream. And there are a whole lot of homes in rural US that don't have that. So that's something that folks need to think about. So I'm proud of the work that Bonfire has done and continues to do to help communities enable telemedicine. And we're here to help. So if you're from a small community and want to know what your options are, don't hesitate to reach out to us. Thanks for watching and have a good day.